In this tutorial, we are going to be looking at the anatomy, definition, structure, and the function of the sternal angle, which we also call the mandibulo-sternal junction. But before then, let's take a very quick revision and understand what is sternum. First, to have a proper understanding of the sternal angle. What I have here on the screen is a typical structure of the sternum, but on different views. The first one is the anterior view. Second one also is the anterior view of the sternum, and this is the posterior view of the sternum, and the LAT is the lateral view of the sternum, and this is the medial view of the sternum. What do you understand by the word sternum? In anatomy, the sternum is a flat bone in the center of the chest, which we often call the breastbone. It has a shape like a narrow plate, and it helps to protect some vital organs in the body. Those organs are which we have along the chest. Those organs are like the heart and the lungs. The sternum have some very important features, that is the manubrium, like the manubrium, and here we have the body of the sternum. And this last part we call it the xiphoid process. And this particular region is what we call the sternal angle. In this other anterior view, this is the sternal angle. In the posterior view, posteriorly, we have the sternal angle here. The laterally, we also have the sternal angle at this point, sternal angle. What about medially? Medially also, we have the sternal angle here. Now let's talk about the sternal angle. The sternal angle is an important landmark in the anatomy of the chest, also called the angle of Lois or mandibulo-sternal junction. Here we have what we call the manubrium, and we said this manubrium is the upper part of the sternum, and we also call it the breastbone. If you notice down here, we have what we call the body of the sternum. So, describing the location of the sternal angle, which is here, you can say it is located at the junction between the manubrium, which is the upper part of the sternum or breastbone, and the body of the sternum. Notice that the sternal angle is easily identifiable by palpation. Palpation. When we say palpation, this is simply feeling with finger, like placing your finger in the maybe chest of the patient to feel the line. And this line is what we call the sternal angle. The sternal angle can also be seen as a slight depression of notch just below the suprasternal notch, which is the smallest dip at the base of the neck where the collarbone meet. Looking at the basic function of this sternal angle, the sternal angle serves as a reference point for the healthcare professional during physical examination and medical procedures involving the chest. Another importance of the sternal angle is for attachment of various ligaments and muscles involving in breathing and movement of the chest. Structurally, we said the sternal angle is formed by the meeting point of two parts of the sternum, which is the manubrium and the body of the sternum. And if these two connect, we have this line which we call the sternal angle, which I write SA, which stands for sternal angle. So in this case, notice that at the sternal angle, these two parts of the sternum, which comes together at a slightly an angle, creating a noticeable ridge, which is here, creating a noticeable ridge bump on the surface of the chest. Yeah, but in this case, we are looking at it. It bumps out like outside. This is was it posteriorly? Okay, yeah, because we are looking at this posteriorly, a posterior view. This is the posterior view, but from the anterior view, it bumped out of the chest. So at a slight angle of around 160 to 170 degree, because here we have 180, So it's kind of cube actually. Instead of 80, we're going to minus at least maybe 10 to 20, leaving behind with 170. This is it for this problem. I hope you find it helpful. Feel free to like, share, and subscribe. And also, I also have video on the spine, and I also have video on the scapula, etc., which I'm going to drop the link down below. Thank you for watching. See